Coach Steph here today at Rebirth Wellness Center in London, Ontario, and I have with me Dayna, who is a pelvic floor physiotherapist and a very active mom with 2 kids. So welcome.
Thank you for having me.
So Dayna, what is a pelvic floor physiotherapist and how are you different or similar to a regular physio?
Yeah, that's a great question and one I get often. So most people are familiar with physiotherapy where you sprain your ankle and you go and they assess your ankle. You go kind of for 2 to 6 weeks based on your symptoms. A pelvic floor physio really is looking at you from top to bottom, kind of assessing what your story is. You know, are you a postpartum mama who's coming? Are you having pelvic pain for other reasons? And then we chat a lot about everything that goes on in the pelvis. So we have pelvic organs that sit front to back in our pelvis. We've got our bladder, our uterus, and our rectum or bowel. So we chat a lot about our habits with those organs as they affect the pelvic floor down here. We assess all the major muscles that attach onto your bony pelvis, so your abdominal wall, your back muscles in the back, your glutes, your rotators across here. And we are trained to do internal assessments if we think that that is what is necessary for your case, and of course if you're comfortable with that. And what we do with those is we insert a finger into the vagina and we assess what the strength of your Kegel is and whether or not you know what to do with the Kegel, which is the common question I get, is how do I do those? Can you relax those muscles? What are the positions of these organs in the pelvic cavity? And we go from there.
Kegels. It's a word that I hear often with my clients. I'm sure you hear it all the time. So tell us, Dayna, what are Kegels? How do I know if I'm performing them correctly? And should I even be performing Kegels?
Yes, those are fantastic questions and very common questions. And I'm glad the last part of that was, should I even be performing Kegels? If we look at the pelvis, the organs sit front to back there, right low on the pelvic floor. If we take these guys out, we'll get a better idea of how they look. The pelvic floor runs from front to back on your pubic symphysis all the way to the tailbone. So it is a large group of muscles that need to lift up into your body, which would essentially be a Kegel. They also need to be able to relax, and they move this way with our breath. So when I ask someone to do a Kegel, what I'm looking for from an external perspective is, does their abdominal wall gently come up and in? It's not a big squeeze. It really should be a light, breathing, tight motion with their exhale. When and if we are assessing internally, I'm feeling for those muscles lifting up and into the body. I often use the cue to pick up a blueberry. Imagine you're picking up a blueberry into the vagina, and that is that cue of that lift up into the body. Now, it's a good question. Should we all be doing Kegels? Kegels are not one size fits all. And if we determine that the pelvic floor has too much tightness or tone in it, we may actually have you do a reverse Kegel, which is really just a nice big inhale and letting go of tension in the pelvic floor.
Wow, that's really good information. And I like that you said pick up the blueberry, which is also your Instagram handle, you know, slide that one in. But I've heard some really bizarre things like pick up the Skittle or pick up the, I don't know, grape and stuff like that. So I kind of like pick up the blueberry. I think that's a good analogy for people.
Yes.
So in regards to your patients, what kind of things do you see symptom-wise with your prenatal and your postpartum clients and patients?
Yeah, such a great question. I typically see people anywhere postpartum, 6 weeks and on. We will start our assessment, and common worries that people report would be leaking of the bladder or the bowel, heaviness, pressure into the pelvic floor, the perineum, ab separation, pain in the pelvis with exercise, intercourse, and just general return to exercise.
With type of delivery, what are some common symptoms that you see and how do you treat them for vaginal birth compared to maybe a C-section?
Yes, great question. So birth, as we know, has many different outcomes, and I see women with many different kinds of birth. We have vaginal deliveries, we have cesareans, we have moms who tried labor and maybe even pushed and then ended up with a cesarean. So there's kind of a wide mix of what birth will look like. With a vaginal delivery, certainly things that can happen are perineal tears, and there's different varying degrees there, so we would make sure that that tissue is moving well. We would make sure that their pelvic floor is contracting and relaxing well. We would assess their abdominal wall, their breathing mechanics, their lifting mechanics, and make sure that system is working really well following a vaginal Now, it doesn't really differ too much for a cesarean delivery in that I always say pregnancy is a marathon. And that marathon is the same no matter what your birth looks like. And so we are still addressing the pelvic floor with cesarean deliveries, which is often a surprise for many women. Like I said, the work of pregnancy still occurred on that pelvic floor, so we want to make sure that it's recovering well from that load. Can the pelvic floor contract and relax? Was there any strain on the pelvic floor, any pain that's happening? With a cesarean delivery, obviously we're assessing that abdominal scar that usually runs quite low, right above the pubic symphysis or the bone in the front of the pelvis. We're making sure that that scar is moving well, and then again, just assessing the abdominal wall similar to a vaginal delivery. Pregnancy looks the same, so we have to make sure that that separation closes, that their abdominal wall and breathing systems are firing correctly. And, you know, if we have had a mom or a woman who has had a trial of labor, maybe even some pushing that ended in a cesarean, definitely we want to assess both in that situation as well.
I really like that you mentioned the stress on the pelvic floor regardless of the type of delivery, because often we forget that, you know, the weight of your placenta, the amniotic fluid, the baby, the uterus, any blood volume increase, any body fat that you've accumulated, all that is impacting the pelvic floor. So even if you don't deliver vaginally, you can still have all that weight that's setting on there, and that can really impact the pelvic floor. And even in the research that I've read and studied, oftentimes we see women down the line as they maybe get into menopause who had cesarean births, but then they're actually experiencing higher pelvic floor dysfunction because they never thought it was something that they should have addressed earlier on. They were always worried about the scar. So I really think that that's an important point to drive home to people.
Absolutely, and I see women in clinic all the time. They've had a cesarean delivery and they end up with some urinary incontinence. And sometimes it is later on, sometimes it's right away. And they feel very confused and lost about why they're having pelvic floor symptoms. And it really comes down to the load during pregnancy. And then in postpartum, the load on our pelvic floor is so much more on a healing body, and that affects that dynamic and that bladder control.
Yeah, definitely. And if you think of pregnancy and childbirth as an injury to the body, essentially, are you recovering? Are you rebuilding that strength? Are you massaging that scar tissue? And a lot of women will say no, right? And so that's where you come in as someone who actually teaches women to be proactive in their pelvic floor health during this time when we can actually maybe have a difference that will last the rest of their lives.
Absolutely. It's pregnancy is the marathon, birth is your final sprint. And if you thought about that from a running analogy to take that even further, you wouldn't think about going to a chiropractor or a physio or an RT. You wouldn't think twice about doing that after a marathon. But for some reason, there's a little bit of a gap in us seeking that treatment after pregnancy and delivery.
Definitely. Most women don't realize that when they give birth, even though there might not be any sort of physical injury, so maybe they didn't have a cesarean, maybe their vaginal birth went well, but there's still an internal wound. Can you elaborate more on that?
Yes. The placenta can leave almost a dinner plate sized wound, like you mentioned, behind in the uterus. And I think when we start to think about it like that, suddenly 6 weeks to return to exercise doesn't seem long enough. And I think we do a little bit of a disservice to women when we call it a 6-week clearance. I like to chat with my moms about 6 weeks really being where that rehab process starts. We can start, we're assessing all of those things. What happened with the perineum, any concerns there? What happens with that, cesarean scar when we start to load it? We want to make sure that scar is nice and healed and not seeping and anything like that. But certainly there's a lot that happens at 6 weeks or prior to 6 weeks that we need to consider.
Definitely, and I know when I see a lot of my clients postpartum, some of them haven't actually had any interaction with a practitioner like yourself, even a chiro, to assess those needs and what that might look like from a rehab perspective. But they come to me and they say, I want to exercise again. And similar to you, I have a really long conversation with women about, what was your labor like? What was your delivery like? Were you hemorrhaging? Did you lose a lot of blood? Then in addition to that, what's your sleep like? How are you coping with motherhood? Are you stressed out? Because all that can impact, their timeline. And I've had women who want to exercise, and I say, you know, based on what you're telling me, I think we need to wait a bit because you've hemorrhaged, you know, your iron's low. Exercising isn't going to make you feel really amazing, so we need to kind of address other things first.
100%. And I think just having a good education session with women really helps them see that. And I often will hear the comment from moms, you know, I used to be able to do this, and why can't I hold my plank longer? And they're 8 weeks postpartum. And I will say, you know, your body just did this massive event. You performed this massive
It's the Olympics.
And you're very much still on a healing frame. And your baseline of activity with lifting and bouncing and carrying and changing baby throughout the day on this healing frame in a body that has hormonal changes and maybe has a cesarean scar that's not completely healed, and you're probably sleepy, it takes longer. And that's trying to change that expectation for them. It can be challenging, but very important.
Especially with women, I can understand who were athletes before, but even women who are not, really getting them to conceptualize what they did as, you know, an athletic endeavor, because labor and delivery can last 6 up until 36 hours. And I always ask women, you know, how are you training for that? And then you can ask, how are you recovering after that, right? And I don't think a lot of people see it that way, but I think it's a really good perspective to demonstrate that women, you know, are strong, are powerful, and they just went through this whole thing. So to be kind to yourself and know that a rehab and recovery will take a while. So giving yourself that time.
Yes, rest is so important, and it can be hard. It can be hard if you're a physical person. It can be challenging for mental health sometimes too, which I think we definitely need to address as well. But it's so important, and it sets the stage for returning to your activity of choice.
Definitely. So 2 common symptoms of pregnancy and also childbirth is pelvic floor dysfunction and also diastasis recti. And I know that's a huge concern with a lot of clients that I work with. So what do you do in order to kind of address that postpartum? And then how does that change if someone's had a cesarean birth where there's scar tissue as well?
Yeah, great question. So diastasis is something that a lot of women are concerned about, and it essentially is our 2 sides of our superficial abdominal wall have a tendon down the middle called the linea alba. And during pregnancy, as baby creates real estate, essentially, we get this separation of those 2 sides and this lengthening widthwise of the linea alba. It is normal, right? There are certainly things that we want to educate women on to be kind to that tissue, always planning for postpartum during pregnancy. But it is very much considered to be a normal part of pregnancy. Postpartum, that is definitely one of the things that we're assessing when women come to see me in clinic, is what amount of tension or lack of tension, I guess, in that linea alba is still there. How many fingers are they separated, which is often like a common way, you know, how many fingers fit down there. So we're assessing all that, and the goal is to close that gap. And even if that gap doesn't completely close, to have really good tension in that tendon down the middle. So I think it's important to mention that sometimes there is a little gap left, and that's okay. That is a healed abdominal wall. With a cesarean birth, we have that scar along the top of the pubic bone. So it will run kind of along here, right, low on that abdominal wall. And so we can develop scar tissue just like anywhere in the body. If you were to cut yourself, you could develop scar tissue. And for lack of a super technical description, it just lays down kind of funny, right? So it can be sticky, it doesn't move quite as well as tissue that hasn't had an incision placed through it. And so we can introduce some scar massage with these moms in order to reorganize this tissue, which then will help with that diastasis healing because the abdominal wall itself is just engaging and moving a little bit better.
Yeah, and you mentioned tissue, and oftentimes people forget how much tissue is actually cut through during a C-section. So to put it into perspective, can you give us some education on that?
There are several layers that they have to go through. Obviously, there's the skin, the superficial skin, and then we have layers of adipose or fat tissue underneath that. And we've got fascia, which is just like a layering over top of our muscles. It basically is like the casing that we have. Very common misconception about a cesarean delivery is that they do not cut the abdominal muscles. So this linea alba that I was speaking of that separates, they often will just kind of pry it apart in that tendon. So they're not cutting the actual muscle tissue. which I think sometimes is a mental boost for moms when they realize that the muscle tissue itself wasn't actually, in most cases, right? There's obviously different scenarios that could have come up, but and then they cut through the layers of the uterus nice and gently until they get down to baby, and if water hasn't been broken, they then break the water.
Oh my gosh, that's so interesting.
Yes. So there's lots of reconnection, and then when they sew those individual layers back up, we want to make sure postpartum that those layers are all gliding and sliding well.
Very cool.
Yeah.
Very cool. That was awesome. I just learned so much there. Outside of diastasis and maybe scar recovery or massage, what are some other common symptoms that women see that they come to see you for?
I would say probably the number one reason that I see women in clinic is for leaking. So, whether that is with a sneeze or a cough, whether it's with return to exercise, or some women get a really strong urge and then they can't quite make it to the bathroom. And then if they're, depending on where they are in their recovery, but the dreaded trampoline, right? That can also happen as well. So leaking is definitely one of the number one reasons I see women.
Yeah, and we're not talking about that one-off leaking, right? Because I know I've laughed so hard I peed my pants a little bit, right? But this is something that it's affecting their everyday life in some regards, right? And their quality of life.
Absolutely, and it can be, from the intermittent leaks here and there all the way up to something, very much every time they feel an urge, they're finding themselves leaking, crossing their legs and trying to get to the bathroom, so it can very much impact quality of life. And there's a variety of factors. One important point, though, is it is not normal. It is absolutely not something that you need to continue to deal with.
It's not a rite of passage of motherhood. Is that you have to wear Depends now?
No, absolutely not. I cringe when I see those commercials. There's so much that can be done in terms of rehabbing that pelvic floor, making sure there's good abdominal support for that pelvic floor. Let's talk about your breathing techniques. We are a population of breath holders, so can we maybe change how we're lifting baby and the load that's going down on the pelvic floor? Many things we can do to help.
Yeah, definitely. And as someone who comes from a lifting and powerlifting background, and I know as well, you exercise very regularly. We're always trained earlier on to perform the Valsalva maneuver, that breath holding before lifting heavy weights. And now looking back, I'm like, wow, that actually has such a negative potential impact on the pelvic floor.
Yeah, it's all just about cumulative load, pardon me. And so I will say this to my moms, if you're finding that you're leaking more after noon hour or something like that, let's look at what we can do earlier in the day and balance that load on our pelvic floor. And then of course, strengthening or relaxing as is appropriate in the background helps to improve control. It's important to note that not all leaking comes from weakness of the pelvic floor.
Yeah.
And again, thinking about when you come to a pelvic floor physiotherapist, one of the procedures or things that we can do for you is an internal assessment to determine, is it weakness? Are we getting that lift of the pelvic floor, or do we need to relax and let go? Some leaking can happen because there's too much tightness in those muscles, and so when you add extra load of urine in that bladder, the pelvic floor just can't quite cope anymore. And so those can be a bit of a tougher sell to patients to let go of tension in their body when they're leaking, and often women are quite surprised when I actually have them do these relaxation exercises that their urgency or their incontinence throughout the day decreases.
Yeah, great points.
Another common reason that women will come to see me in clinic is pain with intercourse in the postpartum period. And this is very common for both vaginal deliveries and cesarean deliveries. A little bit of a misconception, right? It makes a little bit more sense maybe to us that a vaginal delivery and that baby coming out through the pelvic floor, certainly having any sort of penetration could of course be uncomfortable. But with cesarean moms, what we often see is that tension or some scar tissue coming down into the pelvic floor from that scar, leading to elevated tension or tightness in that pelvic floor, which can make penetration, particularly in deeper positions, be a little bit more uncomfortable for them.
Wow, interesting. I had no idea, because I would assume, again, the opposite, that vaginal deliveries would maybe experience more pain because of scar tissue, but it could be equal depending on delivery. So, wow.
And again, another postpartum common occurrence that should not be considered normal. It's not something that you have to just deal with because you had a baby. If you are experiencing pelvic pain or pain with intercourse, there's lots we can do. There's lots of belly and breathing techniques, letting go of tension often in the pelvic floor, some scar massage if you did have a cesarean delivery, even scar massage of perineal scars with a vaginal delivery can really help settle pain with intercourse.
Yeah, and I think women need to also kind of be like compassionate with themselves, because just because their doctor said 6 weeks doesn't mean, you know, that is when they need to go back to having intercourse with their partner, and just kind of creating that dialogue that 6 weeks is this arbitrary number that doesn't really mean anything, and it really comes down to how does it feel, and how can, even as a partner, maybe full-blown intercourse isn't what happens first. Maybe it's massaging, maybe it's more foreplay, right? Like there's definitely an ease into it, and I think women need to really understand that it's their timeline and their body's going to be different than someone else's, and to just give themselves that self-care and self-love, but also have that dialogue with their partner, because I think a lot of men are not really aware that like the rehab and recovery that can take place postpartum, right?
Absolutely. No magic wand waves at 6 weeks. So whether we're talking about return to exercise or return to intercourse, it really is an individual thing. Certainly there are lots of people who are very ready and willing at 6 weeks and it's comfortable for them. But if that's not you, that's also okay. And I love that you mentioned, you know, like intimate touch and foreplay and things like that. That doesn't always have, intimacy doesn't always have to mean penetration, you know? And so I think when we think about it from more of an intimacy standpoint, we help retrain the pelvic floor and our central nervous system's reaction to that intercourse and that pain. I always educate my patients, however, too, that, you know, I can help with the physical. Yes, intercourse is, you know, if we're talking about vaginal penetration, can we relax the muscles? Is there things we can do to help with lubrication? But if it is an arousal or a stress state for you, then I'm referring on to, you know, social work, counseling, anybody who can talk to them about, you know, a sex therapist or things like that, to deal with that mental and attitudes around sex and things like that is super important as well.
Because it definitely changes in the postpartum period, and I've heard from women, you know, even their breasts, right, have now become milk production, so they no longer see their breasts as these sexual objects, where your partner is still thinking like, those boobs are huge and I just want to squeeze them, and you're like, don't touch my nipples, right? So there's even that communication that can be such a mental barrier for women, right? Like their bodies change so much, and that I love that you brought that up, because there's definitely such a psychology behind the postpartum period and the postpartum body, and really trying to work with someone to encourage you to have the best relationship, mind-body connection, because that will impact everything else.
Right. Readiness is physical and it's mental, emotional, and we have to consider both. Okay, so we are going to do a little bit of scar massage here on Steph following what would be a cesarean birth. And there are many things that we want to consider. Certainly your timeline. Usually we're not starting any sort of scar massage around the area until that 6-week clearance from your surgeon, unless otherwise directed by a medical professional. What you want to make sure of is that your scar isn't seeping or is well healed. It's okay to touch for you individually. So, which is a really good point. Sometimes it can feel really yucky to touch the scar, whether that is physically, we don't like how it feels, or maybe there are some emotions tied to that. And in that case, we would start with just some gentle touch, maybe our own hands, some cotton balls, some towels, different textures if you feel like we have to build up to actual firm pressure. So assuming for today that we are okay with some pressure, what we're going to do is a few different techniques, and really you can do a couple of these. You would do it generally with a dry skin around the tissue. It's okay to use a lotion or an oil of your choice on it, as long as that is okay with your surgeon as well. And in terms of pressure, it really is comfort.
I usually recommend doing it a couple times a week, and that should be sufficient.
Okay, so to perform some scar massage, and these are just a few of my favorite techniques, you want to expose the scar. I don't have any lotions or oils here today. You can do it this way. You can use any creams or lotions, oils, as long as they're approved by your physician. Again, we want to come in about a finger or two from the sides for up to that kind of 8 to 10 week mark, only because the anchor stitches are here. So we're going to come in a little bit of buddy system pressure with our fingers and apply some downward pressure and then wiggle and work our way along the scar. 5 to 10 wiggles, very technical term, across the scar. We can then also take 2 or 3 fingers and apply some pressure above. Move up and down, side to side. Does that feel okay for you, for mom? Perfect. And do that below as well. The bladder is right here in the midline, so if you feel like you have a bit of urgency as you poke into there, that is considered to be normal. Certainly any pain as you poke over the bladder should be noted. And then I also like to think about just picking that scar up as well. So gently kind of squeezing above and below and just lifting that scar nice and gently upwards.
So, a couple times a week, 2 to 3 times a week, up to 5 minutes, as is comfortable in terms of pressure. We don't want it to be painful for the rest of the day by any means.
Okay, so we are going to teach Steph how to do a core breath, or a Kegel breath, I often will refer to it as. We are a canister in our middle. So we have our abdominal wall, our back muscles, our pelvic floor on the bottom, and our diaphragm, or our breathing muscle, up top. When we take a breath in, your diaphragm will move down and lower, your pelvic floor should soften and relax, and your tummy should soften and move outwards. When we breathe out, we get this lift or Kegel of our pelvic floor and this up and in drawing of our tummy. When you are doing a Kegel, nobody should really be able to tell that you're doing anything more than breathing. So we don't want to be squeezing the bum or the legs together. We don't want to be looking like we're really squeezing up into the upper body. So, Steph, I'm going to have you take a nice big belly breath in and think about expanding that tummy. When she does that, she's getting the lowering of that pelvic floor and diaphragm, and then exhale, gently draw your belly button up and in towards your rib cage. Good, take a nice big belly breath in. And this time I want you to think about drawing a blueberry up into your vagina. Fantastic. So as we can see, that movement looks very much the same. It's nice and gentle movement of her abdominal wall as she comes up and in. She gets this nice expansion of her tummy with an inhale. And then with her exhale, she's going to gently draw that blueberry up and in. What I often will see, things that can kind of go awry, is a big bum squeeze. So I will say, take a nice big inhale in, take a nice big inhale in, and then do your Kegel. And some people will squeeze their bum trying to muster all that gumption to get their pelvic floor to lift, so we don't want to see any of that. We can also see a lot of kind of a crunch happen in the upper body. So take a nice big inhale in, and then I'll see a crunch happen up in this upper body. So that's really more superficial part of me, abdominal abs. Another common thing that I'll hear people say is that inhale feels backwards. So they take their inhale in, I'll have you pull your belly in with your inhale.
Oh yeah.
And they will inhale up and in, and then their exhale has nowhere to go. Yeah. And that's a common way that we breathe. We breathe into our upper body as opposed to our belly. So that belly diaphragmatic breathing you'll sometimes hear it called is part of the exercise, is inhaling and letting that tummy go, which then reduces pelvic floor tension. So we consider that part a reverse Kegel, and that exhale, lift that blueberry up and in, is a perfect Kegel. Okay, so we are going to go through a bridge exercise, which is a common exercise that I use with clients, usually starting anywhere in that 4 to 6 week mark. Particularly if you're not having any sort of pelvic pain or anything like that, we can go ahead with this exercise. We want to keep nice strong glutes in the postpartum period. You are doing more than this exercise if you were getting out of a chair, so it's a very safe one to start with. It really is considered general range of motion. If you are a cesarean mom and you do this and you notice any sort of pulling or a lot of pain in the scar, we're gonna wait a little bit longer for you to start this exercise. But we're gonna start with just your bridge, and then we'll add some breathing onto it. So I'm gonna have Steph bend her knees, so her feet are on the floor. And let's start with a perfect bridge. So a bridge is really kind of gently squeezing your bum and lifting those hips up off the floor, staying in nice alignment through the front of the hips, and then taking that bum back down to the mat. Now, we're gonna go through some of the common things that we'll see with a glute bridge here. So I'm gonna have you lift up and in. So what we can see is the hips are kind of really being thrust forward, the knees are splaying apart, we've got a little bit of a rib cage flare here. So we're just putting a lot of extra stress on these tissues, particularly if you're a C-section mom through that scar. So again, the difference is, I'm gonna have you lift up nice, slow, controlled. We're flat through the hips, our rib cage is drawn down towards the pubic bone or the pelvis here, and then lower. We always want to breathe. We don't want to do this while we're breath holding. So when we're talking about engaging or using our core, and by core in this situation, I mean that pelvic floor and our belly, we want those muscles to gently come up and on with our movements and not be breath holding and bracing, which is going to put a lot of strain through the abdominal wall or down through the pelvic floor. So the hardest part of that exercise is the lift of the bum. So we're going to pair that with our exhale. So we're going to take a nice big belly breath in, expand that tummy, relax everything before we go, and exhale, lift the hips nice and gently up off the floor. Inhale on the way down. Good, and go again, exhale, lift. We're getting nice pelvic floor contraction there, and inhale on the way down. So it's important to note when you're doing this, we don't have to be picking up a blueberry or doing a Kegel in this position. Your breath is what is driving that. We don't have to kind of overthink these motions. Inhale on the way down. Fantastic. Okay, so we are going to go through a common exercise in the postpartum period called a bird dog. So we're going to start right from the basics and then give some progressions. I often will have women start this kind of starting to play around with it in that 4 to 6 weeks postpartum if it feels good to you. No leaking, no pain, no pressure through a cesarean scar, if that is what happened with your birth. If you feel any of those things, we're certainly going to wait until the 6-week mark. And when I say that 4 to 6 week mark, I really just mean this first one that I'm going to do. The progressions, we want to wait until 6 weeks and beyond. So what I will often have women start with is finding a neutral pelvis, and what does that even mean? So if I have Steph kind of drop her tummy down towards the floor here, we get this little bit of a curve. And if I have her come all the way up and out of that, we're getting a little bit of rounding, and then we're going to find kind of that mid point, and that is what we consider neutral. It doesn't have to be perfect for this exercise, but that is when someone says to find a neutral pelvis, that's usually how we do it. In this position, we can practice the breathing, that core breath or Kegel breath. So I want you, Steph, to take a nice big belly breath in. You're going to expand your tummy down towards the table or the floor, and then on your exhale, gently draw your belly button up towards your spine. Good. Take a nice big inhale. Expand all sides. You can think about expanding all sides of that rib cage there, and then gently draw that belly button up towards your spine. Fantastic. You can even think about the pelvic floor specifically here. So take a nice big belly breath in, and then pick up that blueberry gently into the vagina in this position. So we're just using a little bit of gravity to challenge those structures. If we are now at that 6-week mark and you're wanting to try a little bit of movement, we can start to move our table limbs. So I really want you to think about being a table. Tables cannot shift their weight. So I'm going to start by having Steph raise her left arm, but the first thing she's going to do is that press. So she's going to take a nice big breath and expand, let everything relax. Exhale, pull that belly button up towards her spine, and then gently move that arm straight forward. Inhale back down, and you can alternate for a little bit of spice. Good. But as you can see, she's not shifting her weight to make that easier for herself. And do you feel that work come into your abdominal wall when you lift that table leg?
Definitely, because you want to kind of follow one way or another to try to support yourself.
Absolutely. So it's work to stay in that middle position. If you've done those for a week or so and that feels good to you, you haven't had any pelvic symptoms, urinary leakage, pain, pressure come on, we can start to progress to moving the legs, which is definitely harder. Exact same procedure though, you're gonna take a nice big breath in, expand through the rib cage and the tummy. Exhale, start that engagement, belly button towards your spine, and then let's start with your left leg straight behind you. Perfect. Inhale back in. So Steph did a fantastic job of that. It is very common. I'm gonna have you do one where you completely shift. So if she were to completely shift her weight, see how she came right close to me, and then we're getting a lot more rotation opening up through the hip there. So thinking about a water glass sitting on the back of your pelvis here, we don't wanna spill it. So you take a nice big inhale, let's do your right side. Exhale, engage, and lift nice and flat through here. Beautiful. So the next progression from here, usually kind of around 6 to 8 weeks, depending on how your recovery is going, we can start to lift opposite arm, opposite leg. So you're gonna take a nice big inhale, expand that rib cage, exhale, engage your tummy. Nice and flat, still a water glass sitting here, extension of both, inhale back in. Fantastic. Beautiful. Really great postural exercise that incorporates the back muscles there as well.
Yeah, and oftentimes I'll see something like that.
Yes.
People, so
Yes.
how do we correct that?
Right, yes. So we want to lift straight out. So as Steph was just saying, if I'll have you sink right down, we lose that neutral pelvis when we lift the opposite arm, opposite leg. So watching yourself in a mirror or having a partner watch you do this can be helpful. So I'm gonna have you lift up and go into that extension just like you did. So she's really got her curve there. So we really kind of bowed her spine. So being mindful of, keeping that belly button towards your spine will keep this pelvis nice and neutral, and you can really just use your breath with that, okay? So nice big inhale, one more. Exhale, belly button to spine. Keeps this nice and stable with that extension. Okay, we are gonna take Steph through some abdominal progressions and things that you can watch for in your abdominal wall as you start to challenge these muscles. So following pregnancy, it's very common to still have a separation of the abdominal wall and some softness in the tendon that runs down the center of that abdominal wall. You may have heard people talk about coning or tenting or peaking, and I will show you here on Steph where that would be and why it's important for us. So a very just rudimentary test that I often will have women do in clinic is have them lift their head. And what you're looking for, and Steph doesn't have it here, she's doing a good job of mimicking it, is an actual tenting of the tissue in the middle. It will literally pop up right along your midline. Please don't be alarmed if it happens, and particularly if you're still in that 6 to 10 week mark. It's very, very common. Along with that tenting, you want to get an idea of how soft does that tendon feel to you. So when you stick your finger, for lack of a better description, into the center line, does it feel really squishy? Does your hand go right down into the tissue, or does it feel like there's a little bit like a trampoline or some resistance there for you? So I will have women do that at rest, and I will also have them do it in this position as well. You can do this assessment on yourself as you start to challenge your abdominal wall. So whether it's with these stepwise ones that we're going to do with these bird dog progressions, or even in planks, which is a common one. To take yourself into a full plank early on can be a lot of strain through that mini elbow, would you agree? So I always like to start with these progressions, and if you feel like you're managing tension well, and I'll give you tips and tricks of what to look for, then we can start to challenge you in maybe some of those tabletop or plank positions. So my favorite one, if you've done the core breathing in this position, is to start with your knees bent, so your feet flat on the floor. And what I'm gonna have you do, I usually talk you through it first, is take a nice big inhale into that belly, expand your tummy. You're going to exhale, draw that blueberry up and in, and then gently bring one knee to your chest with the rest of your exhale. Inhale on the way down. Exhale. Fantastic. So then I will say, when you're doing this one at home, I'm gonna have you kind of self-assess here. Do you feel any really squishiness coming on? Does it firm up in the midline when you engage with your pelvic floor? If the answer is yes, then you are safe to do this exercise. I generally won't start even this base one until about that 6-week mark, regardless of birth, vaginal or cesarean. Okay, so we've done this one for a few days, maybe a couple weeks, depending on how long it takes to develop some tension there. We're now gonna make it a little bit harder, and Steph is gonna take her leg long to hover. No, sorry, so starting from here. So with your exhale, I'm gonna have you take it down there. So bring it back. Good. Same thing, she's assessing that tension there. Now, if she were to do that and she felt some squishiness in that midline, or it really felt like it domed up there, or she wasn't able to keep her back nice and flat, which she did, that was great. I always have them reset from the beginning. Make sure that you can draw that pelvic floor up and in, and then try again. One of two things will happen. She's gonna notice that she's now able to keep that back nice and flat. She's got great tension in that tendon. She's not getting any doming. That means she's good to go. She reset, she really focused on connecting to that pelvic floor and deep core, and she's safe to go. If she doesn't feel that, we're not quite ready for this stage just yet. Okay? Step 3 we're gonna take her to is bringing both knees up off or feet, I guess, up off the mat. We're standing in this, or starting in this tabletop position. A little bit different. So now we're gonna hold some tension in that pelvic floor. So I want her to think about picking up that blueberry and holding it there, but still have air going in and out. So with her exhale, I'm gonna have you keep a knee bent and tap a toe down. Perfect. Assessing, just like I told you, for any tension, changes, really softness, back pain. If this feels too hard to fully extend, you can keep, and I'll have you do it with this right side when you come back up, you can keep the knee bent and just tap the toe. So down a little bit more like that. So you're shortening that lever arm. Perfect. Beautiful. We don't want to see any of this lifting in the back. That means we've lost some of this core contraction. Maybe we've dropped the blueberry. Maybe we're breath holding. So we're getting some of that pressure out in the canister. And so if you start to feel any back discomfort, you're kind of intermittently assessing that abdominal wall. Just reset. If those things disappear and you're comfortable, you're safe to continue. If you can't quite get your back to settle, you can't really feel that core contraction come on, then we're gonna pause and go back a step. Perfect. Okay. I would say if you're not able to do, 10 or so of those bent knee, we don't want to add the arms on, but the last portion would be to add the arms on. So I'm going to have you bring your arms and your legs straight up. Perfect. And the higher level, I usually have women doing this, in that 10 to 12 week range, would you say postpartum? Same principles apply. We're going to drop opposite arm, opposite leg. So if you're sleepy, this one can be tricky to do, but you're gonna exhale, drop those limbs, inhale, bring it back up. And she's got really lovely control here, nice and flat, nice up and in drawing, and no extension or arching through her back there. Beautiful. It's like you've done this before. Awesome. So I'm going to give you some tips and tricks on how you can do a little bit of lifting, particularly baby or car seat following a delivery, whether that's vaginal or cesarean. Following a cesarean, the surgeon's orders will often be don't lift anything more than baby, following that surgery for up to 6 weeks, and so we obviously want to listen to that. But even when you're lifting baby, it's important that we are using our breath, not breath holding, which is going to increase pressure in our canister. Our canister in the middle is our abdominal wall, our back muscles, our pelvic floor, and our diaphragm. When we breathe in, our diaphragm will move down, we get air into our lungs, our pelvic floor should soften and relax, and our belly will move outwards. When we breathe out, we get this lift or kegel of our pelvic floor, this up and in drawing of our tummy. So we want to utilize that exhale and that engagement of our core to protect our pelvic floor and our abdominal wall. So if that's picking up baby, I want you just to think, exhale and pick them up. Once we've gotten clearance from the surgeon that we can start to lift a little bit more, particularly car seats. Car seats are awkward and can be heavy because they have baby in them, obviously. I'm going to have you do the same sort of thing. It is recommended for the car car seat that you actually take your hand underneath the handle and then grab onto the side. It can be a lot kinder to your low back. And then you're thinking about that same breathing pattern. So you're gonna exhale, lift up with baby. When we exhale, remember we're getting that lift of our pelvic floor and avoiding a breath hold, which is common. We'll often see women go like this and they lift everything up and they're holding their breath and then they're waddling with their hip out to the side. And so we want to be mindful when we're doing repetitive things like this throughout our day and week that we're using good technique most of the time. So again, you're gonna loop your arm underneath, grab onto the side. Most car seats have this circle here. Exhale, use those legs. Protect your pelvic floor and your abdominal wall with your breath.
Dayna, thank you so much for joining me today and for sharing all of your knowledge with us.
Oh, thank you for having me. I hope there were some little pearls in there for everybody.
Definitely, definitely. So where can people find you?
Yeah, I spend my days at Rebirth Wellness Center in London, Ontario at the Hyde Park location. And I am also on Instagram at Pick Up the Blueberry.
Amazing. So check her out. I'm Steph and thanks for watching.